Alright, so this mobilization is going to take a relatively big ball. Let's see how big. I have a supernova here. You can also use like a softball. If you have a lacrosse ball, it's going to be hard to lay on top of that because they're going to be laying on my stomach. And so if you're using a lacrosse ball, then you're going to want to set it up on top of something, and it allows it to get some height off of the floor. So what you're going to do is, what we're aiming for is the getting into the iliopsoas area, okay? So in the iliacus area is like, I have my pelvis, there's a bone right here, this crest that comes up here. I want to go right inside of that. I'm getting the meat of my abdomen here. It's right above where my hip or my femur meets my hip here. So I'm going to be right above that. I'm going to lay on top of this. So imagine you start with that ball right on that bone, and then you're going to kind of roll right into that, okay? And so once you're here, you're going to want to just kind of practice some contract relax as you breathe. So what I mean by contract, I'm going to tighten that abdomen, take a deep breath, and when I relax, I exhale and allow that ball to sink in deeper, okay? And you get some really light side to side motion here, but you're not going to want to move very much. You're just going to practice some contract relax to get some deep pressure into this abdominal region. Okay, so and as you go from breath to breath, you're going to set a clock for 2 minutes on this, and you'll slowly, from breath to breath, work your way down closer to where that leg inserts into that hip, right where that femur meets the pelvis. So as you work through this, you might find some hot spots, some spots that are really a little bit angry, especially if you've been having some knee or hip or lower back issues. This might be a little bit upset here, okay? So you want to really practice contract, take a long deep breath, and if you can breathe as much as you can through your nose, it's going to help you relax even more. Take long, slow, deep breaths and long, slow exhale as you go through this. As you get through 2 minutes, I'm going to move all the way down close to the hip capsule here and continue to work through this. Contract, relax. So when you contract, you're going to push that knee into the ground, feel that muscle tighten, and when you relax, you're going to feel the weight of your body go into that ball and let it sink in deeper. It's going to help loosen up those tissues to help allow you to move a little bit more freely. It's going to do a world of change for your ability to squat and have your hips moving the way they need to.